everybody. Today we're going to talk about electroconvulsive therapy. See you in a minute. Electroconvulsive therapy, aka electroshock therapy, is considered to be a very controversial treatment in psychiatry. I have to say that I've had it. I've had it at least 3 separate times, which means you have 3 sessions. So you have a series of ECTs.
ECTs.
I suffer from major depressive disorder as well as DID. And sometimes my depression gets so bad I will do anything to make it lift. It's unbearable. So when I was in my 20s, I had my first series of ECTs. I had 7. I was terrified because, I read all the stuff on ECT, you hear the history of it. It's like, according to literature, it's the next worst thing to a lobotomy. And let me just tell you, I'm terrified of lobotomies. But it's not true. ECT is a really great tool to help people with bipolar disorder, with depression, with a host of different disorders. When I first had it, I was terrified I would lose all my memory, I wouldn't remember anything, it would lower my IQ, I would be dumb for the rest of my life, but the risk of not getting it was more dangerous than the risk of getting it because I was so dangerous to myself. So if you look back on literature, you'll know that ECT has been around for quite some time. In the beginning, they used to use insulin. It was called insulin shock treatment, which was definitely not healthy. One of the famous people who had insulin shock treatment is Sylvia Plath, one of my favorite poets. And what happens, they would inject you with insulin when you didn't need it, and your body would have a seizure because it did not need insulin. But they found that the results helped, that it lifted severe depression. And so when I was in my late 20s, the first time I had it, of course going in, I was freaking terrified, just terrified. And yeah, I thought about all the things you hear, all the rumors, all the history, everything, that it's torture, that it's barbaric, that it's something nobody should have done to them. And it was all in my head, but at the same time, I also was it was a choice between doing something very scary or potentially dying. And so I chose the scary thing. I don't regret it. ECT helped me get out of depression more than anything I've ever tried. Medicines don't work very well for me. But the first time I had it, I had 7 sessions. And basically how it works is, usually when you're getting ECT, you're inpatient on an ECT unit because 6 months around the time that you're getting ECT, your memory's gonna be off, your behavior could be a little bit off, and so they need to observe you and make sure you're okay. And so I was inpatient, and what they would do, Monday, Wednesdays, and Fridays, you would have your ECT. You'd have to get up at like 6 in the morning. Well, you have to get up like 5. You have to be there by 6. You have to sign in. Like, these are the people who were outpatient, actually. If you were inpatient, you went after the outpatients. So there were people who did not stay in the hospital, but that's usually because they already did their intensive ECT 3 times a week, and now they're at once a week or once every 2 weeks or once a month because there's maintenance doses of ECT, electroconvulsive therapy, if I haven't said it. And so you start out inpatient, and so I was inpatient for a few weeks the first time, and I had 7 treatments. And I'd have to say, yes, did it mess up my memory around that period of time? Those 6 months, yes. Did I get a lot of my memory back? Yes. Did it affect my IQ? No. That is a myth. And I've just seen a lot of videos of people talking about how scary ECT is. Electroshock! Oh, you shouldn't do that. And I just want to counter that because it's a very important tool for people who suffer from depression, bipolar disorder, a host of disorders. It's the one thing that pulled me out, saved my life. And so I had it done a couple of other times later in my life. I had 12 sessions once. I can't remember the third one. I might have even had it 4 times altogether. But I just don't want people who already don't have a lot of options to feel better not to try something because of the rumors, because of what they read. You know, my experience is that, yes, it was scary at first, but it worked. It did its job. It did not mess up my brain. I can tell you a few stories that were kind of scary for me in particular about ECT, but these are, you know, once in a lifetime things that would happen. Most people did not have these experiences, and probably the reason I had them is because I have DID, and at the time I didn't know. Okay, so one time, which is one of, it's very traumatizing, but I don't want this to scare you away because this is like a fluke. This never happens, but it just happened to happen to me because I have DID. Anesthesia is involved. You need 2 types of anesthesia with ECT. You need a hypnotic and you need a paralytic. So what they do is they put an IV in before you go in, and they put the hypnotic in first, obviously, and then they put the paralytic so you're not aware that you're paralyzed. So this one time, and I know this sounds counterintuitive to what I'm doing. I'm telling you, don't be afraid of ECT, and I'm gonna tell you this scary story, but I'm just trying to tell you, you know, some stories from my life. And even though this happened, I still went back and got ECT. So put it that way. That's how well it works for depression. So I had a new anesthesiologist for this particular session, and they didn't give me enough hypnotic. So my hypnotic wore off before my paralytic wore off. So during the session, I started to become conscious. The problem is when you have a paralytic in your system, you cannot move your lungs to breathe. I had air being pushed into me because, you know, they're pushing air in, they're making sure you're alive, you're okay. So I was getting my oxygen. But when you can't inhale, even if they're pushing air into you, you feel like you're dying. You feel like you're suffocating to death. I couldn't inhale. I could not do that. And so this must have been right at the tail end because I started to come out and I was screaming at the top of my lungs, screaming. I couldn't breathe, I can't breathe. And it was awful. And the next thing I know, I'm gone again. They put me back under. I wasn't supposed to wake up at that point, obviously, because I couldn't move my lungs. And so that was the one horror story that I have from ECT, but I will say this. I would not discourage anybody from getting it because that was a fluke. And it helps so much with depression, and it helps so rapidly that you would be stunned at how quickly you're gonna get well. It's just a choice you have to make on your own. And but here's another story that I have from when I had ECT. Okay, so usually when you have ECT, you really don't remember at all around the time that the anesthesia is going in. Like for the 15 minutes before you go under, you're not gonna remember anything. For some reason, I did. So one time I was just about to go under, and this was after I had that incident with the anesthesia, so I was like super terrified. I would like force myself to stay as conscious as I could so they'd give me as much anesthesia as possible. I know. But actually, like when they put the anesthesia in, it feels really good for like 15 seconds. It's like heaven. But no, that's not why you should be doing it. But you know, I was terrified because I had that one incident where I couldn't breathe, or I felt like I couldn't breathe. And so I would just like force myself to be as conscious as possible. And so they thought I was under, and my doctor, because it was a teaching hospital, I was at a teaching hospital, and so what I heard right before I went under is this. Now watch this because you're never gonna see it again. That's what my doctor told his students in the room, and I held on to that somehow. I remembered it. And so whatever, ECT happens, it's very fast. I wake up, the next day I see my doctor, and I say to him, why did you say that to the students? And he was stunned. He was like, this is what he told me. He said, basically, you have a disinhibitory response to anesthesia, which is typical for people who have suffered severe trauma. So my assumption is it's possible that maybe an alter came out and said some stuff that I'm not aware of, but you know, I never knew, because at the time we didn't know I had DID. So those are the two stories that I have, but I also want to tell you a little bit more about ECT since I'm just telling everything out of order. You're welcome.
You're welcome.
ECT, the electricity is not the treatment. Basically, it's enough electricity. It's so little electricity that you can't even power a AAA battery with it. And what happens is they strap like a rubber strap to your head. There's a plate here, right? And they have a pulse. It's not like zzz, it's like a pulse of electricity. Pulse, 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 pulse. And the treatment is, it triggers the seizure, and the seizure is the treatment. And the doctor that I had, he had a theory on how ECT worked. He felt that you had to reach a certain, overall through the whole series of treatments, you had to reach a certain number of seconds of seizure time to get better. So he would measure the seizure time. And for me, I had a very high seizure threshold. So my seizures were often very short and very difficult to cause. And that's one of the reasons that later I had more treatments than, you know, the usual sometimes. But I don't regret it one bit. I'm grateful that I had those. My doctor, he was actually a pediatric neurosurgeon turned psychiatrist. And so I really trusted his opinion on things. And I just really want people to keep that type of option open, especially when you have DID, because depression is intrinsic with DID. It's a big part of DID. A lot of people think that DID is just, you know, acting like different people. No. It comes with anxiety, it comes with depression, it just comes with a host of mental health issues. So anybody out there, if you're feeling severely depressed, if it's a life or death situation, I would suggest you consider it. Do your research and consider it. It's not like it is in the movies. It's not like it is in One Flew Over the Cuckoo's Nest or in all these things where it's like zzz. It's not at all like that. It's a tiny little pulse that ignites a seizure. The seizure itself is the treatment. And so I just wanted to put this out there because, you know, I think people need to know that it is not what you think it is, and it's a useful tool in treating yourself. Especially when you have DID, it's hard enough already. You don't need depression on top of it, though they go hand in hand, unfortunately. And so, you know, I just wanted to tell you guys that story, and hopefully, you know, you don't suffer the type of depressions I suffer, and you won't ever have to make that choice. But if you do, remember this video. It is not as scary as you think. It is not going to damage your brain. And it will help your depression most times. I'm not saying it's going to help everybody. Everybody's different. Some people don't respond to it, but the majority of people do. And one other thing that I did see with ECT is it really helps bipolar disorder. If you're manic, you get ECT, within a week, you're back to yourself. I saw that happen with another patient because when I was doing outpatient ECT, this one patient would come in and I swear, I just thought she was a bitch. I'm like, this lady is a bitch because she would sit there and say, I don't even want to do this. Like she was just nasty. After 3 treatments, she was the sweetest woman in the world. It turns out her mania manifested in that particular way. And so I've seen amazing things with ECT. So, you know, if ever, you know, and you're in a bad space and you just don't know how to get out of it, you've tried medication, you've tried therapy, you've tried everything, really, consider ECT. It's not what you think it is. And thank you for watching my video. I know, you know, and I really appreciate it. And I'm so grateful to have you guys. You make our lives better, as always. So take care. We love you. Bye.
That I was the one that made us happy. And I made it
I made the video with Brandy about, I did about the, electroshock therapy, and I made her happy enough to make it.
Oh, that was nice of you.
Because she let me play with toys.
Oh, awesome.
So I got to be happy. We love you.
I love you.
Love you too. And we can't wait for the tent. We really want the tent so we can play in the tent. It'll be fun.
Oh, very, very soon.
Just blush on.
You put that on?
No, they came that way.
Oh, nice. What's her name again?
Tickle.
Absolutely.
Tickle is pretty.
So I'm transferring your video onto the iPad. Working on it.
Okay, I'll go back inside now. But I still want a chicken. I want a chicken still.
Do you want?
I want a chicken I can hold.
We found it. We just have to. We got to order it tonight or tomorrow. Well, I'll talk to Brandy.
Okay. Thank you.
You're welcome. Love you.
Love you. Okay. She just needed to come out, I guess. She made my day better. And, you know, she's a sweetheart. So that really helped.
Nice.